What's up, guys? It's your boy Vic, and today I'm back with another video on TRT, and this is part 2 where we're going to get into blood work. We're going to talk about injections, how to do them, how frequently to do them, etc. We're going to talk about taking too much testosterone, what that looks like, and finally we'll get into some Q&A and answer some of the comments that people have left on the last video that I posted on YouTube, and some people messaged me privately with some questions and concerns. And again, disclaimer, I'm not a doctor. This isn't medical advice. Do your own research, consult with whoever you need to consult with to feel that you're making a good choice for your health. This is just my experience. This is just sharing what I know. I'm not an expert on any of this stuff. I'm not an expert on blood work. I'm just sharing what I know, and it's up to you to determine whether or not you think that I'm full of shit, or whether what I say has any merit and application to your life. Okay, so with that preamble out of the way, let's get into some of the blood work. Now, mind you, again, it's December, right? So July, August, September, October, November, December. So we're like at 6 months, a little under 6 months of TRT. And just as a refresher, I'm 37 years old. I was 37 when I started. I'm about 6'1". Started at about 95 kgs. Now I'm weighing about 102, 103 kgs. And I'm leaner than I was when I started as well. And one of the things that people kind of, I guess, they don't ask me necessarily, but this is a topic around testosterone, is if you already have good testosterone levels, but you don't feel good, do you need to get on testosterone? Like, the lab says that I'm good. I know I'm not good, but the lab says that I'm good. Am I going to mess things up by going on testosterone? And you can see here from this test that my total testosterone, I don't know, actually I can zoom in a little bit, but basically, yeah, my total testosterone was 734 nanograms per deciliter, which is in the mid to high range. And the free testosterone, which now that I've read around a little bit more, apparently it's not that good of a measurement, because it's actually a calculated measurement. It's not something directly that's measured, was quite low, right? So my understanding is that you want your free testosterone to be about 3%, at least about 3% of your total testosterone, right? Mine was 1.4%, so half of what it should be. So that was kind of my first indication that, well, wait a minute, you could have high total testosterone, which actually does matter. The more total testosterone you have, the more is going to be available. But if a bunch of it is bound up by, let's say, sex hormone binding globulin or albumin or whatever, then it's not going to be as available to your body. And you know, I think the thing that I've learned is that there's a lot that we still don't understand. Like, for example, it was thought for the longest time that if you have high SHBG, and I'll show you guys what that is in a second. Yeah, here it is. It's the second one. If you have high SHBG, and you can see mine was 58.9, and the male reference range is between 13 and 71, so it was on the high end. It used to be the case that people thought high SHBG means it just your testosterone binds to the SHBG, and then it's not available to your tissues. And now the understanding has evolved to say, well, actually the bound testosterone travels through the body to some particular sites where it does have some effect on tissues. And really, if you look at things holistically, it makes sense, right? Nothing's going to be black and white like in a textbook or on a lab, right? Like, the body is an amazing piece of machinery, and it does things in a very, very complicated, hard to understand way. So just because you have high SHBG, and the prevailing theory is that, well, that renders the testosterone unavailable, and now that's changed, it kind of makes sense, right? Like, your body knows what it's doing. And so I take these numbers a little bit with a grain of salt. I feel like they're just data points. They're just a reference, something to quantify a starting point, quantify what happens after you've made some kind of change, and basically just try to correlate what happens on the labs with how you actually feel in real life, which to me is kind of the ultimate thing that you're looking at. And so albumin was a little bit on the high end, which is also something that binds testosterone, although with weaker affinity. And if you guys listening out there are like biochem people and I sound retarded, I'm fine with that. Like, I'm not a doctor, I'm not a chemist, not an organic chemist. I don't understand this stuff at a deep level. I'm just sharing what I know so far. And I'm happy for you guys to leave comments to teach me as well. And so anyway, that is one lab. And then the other lab here is blood count. Everything is within range here. I'm not going to go into that. Basically everything was within range. Platelets, hematocrit. So the one thing that supposedly, and again, opinions vary on this as well, but supposedly you really want to be careful with your hematocrit because as you go on testosterone, it will rise, your blood will thicken, and then some people recommend going to donate blood to avoid that thickening or to mitigate it. And again, opinions vary. Some people say, actually, you don't need to worry about that. Of course your hematocrit is going to rise. Of course your estrogen is going to rise. All of these things are natural consequences that they don't necessarily need to be then treated as a separate issue. I don't know. Again, I'm going based on how I feel for the most part, and I feel great. So that's kind of my thing. And DHEA was, I guess, a little bit low, but within range. And triglycerides were normal. Cholesterol is high, but I'm not worried about it at all. Because it's not that high, number one, and number two, high cholesterol doesn't mean shit, in my opinion. Okay, so those are the bloods. That's what I started with in June. And this is going to be a little bit of a letdown, but I don't have new bloods to show you. I haven't done them yet. But what I can tell you is this, let's say I went and did bloods today and then I got them back in a few days and they said whatever they said. I probably wouldn't change anything, and I probably, unless it said something ridiculous like hematocrit is like crazy out of range, which I'm pretty sure you would feel if it were. If your blood was that thick and your hematocrit was that high, your blood would probably be pretty thick. You'd probably feel it. There'd probably be some kind of symptoms to it. Or if your blood pressure was really high, that's another thing to watch out for. Or, if you're basically you would probably feel that something is amiss if you're fairly in tune with your body. And I think I am. I'm pretty sure that you would feel that something is not quite right. Could be wrong about that, right? Like a lot of people think they're cool and then they go to get some test and then they find out they're all fucked up. So I could be wrong about that, and I know that I got to go get the bloods, and I'm going to get the bloods. But I think barring some kind of edge case scenario where something is really messed up, I probably wouldn't change anything. And the reason for that is because what are you going by? Are you going by what the labs tell you, what the reference ranges tell you, and what that's supposed to feel like? Or are you going by how you actually feel? Right? Because to me, that's the standard. That's the criterion is, do I feel better than when I felt pre-testosterone? And then also importantly, do I feel better at a particular dose? We'll get into that in a second. Do I feel better at a particular dose of testosterone versus another dose? And because to me, that's the whole point, not to chase lab numbers. Okay, so that's a little bit about blood work. I'll update you guys with new blood work once I get it. And now let's move on to the injections question. So this is maybe, just a lot of friends, a lot of people like in the gym, at jiu-jitsu, who saw my first video. And I honestly didn't expect to get such a nice reaction from everybody. So thank you for everybody for your kind words. it's really wonderful to me to be able to just share my experience and hopefully benefit some other people who are maybe in a similar situation, maybe in a worse situation than I was in. Maybe like I've even had people tell me like, man, you know what? I feel like shit. I should go get my testosterone checked. And I'm like, yeah, you probably should. You probably should just hop right on it. Is honestly kind of my go-to advice, but people are going to do what they want to do, and that's their thing. So, yeah, a lot of people say like, well, here's the first thing that people say. They're like, well, how do you inject? And there's kind of a few different theories on this, right? You can inject directly into muscle, or you can inject into fat subcutaneously, right? And for me personally, like, I didn't want to deal with like big ass needles, and I didn't want to inject into muscle because it scars the muscle. It creates scar tissue, and it's probably more painful than going into the fat. And I didn't really find any compelling evidence to say that intramuscular versus subcutaneous is better or worse. I think there's even been like a study or two, but I didn't find like a compelling reason to do one over the other. And I thought, okay, I'm just going to do whichever is the more convenient one and sort of the easier one, which is subcutaneous for sure. You don't even feel it, right? And so that's another question is, does it hurt? Does it hurt, Vic? No, it doesn't hurt at all. So I think the thing is, well, it depends where you inject it, right? If you inject it into your stomach fat, which is what I started off doing, I really don't like that feeling. I mean, honestly, I feel like I'm fucking committing ritual suicide, with a needle every day. It's a very sensitive area. It just somehow doesn't feel good. So where I inject it is right above right below the hip bone. There's a pad of fat kind of on the side of your body between your butt and your groin, and I just take a little pinch of that, pop in the insulin syringe, don't even feel it, and we're good to go. And so another question here is like, how often do you inject? And this is a matter of preference, and it's also a matter of debate. But my understanding is the more frequently you inject, the less the testosterone aromatizes, which means it turns into estrogen, and the less side effects that you will experience as a result of that aromatization. So I knew right away that my whole goal from the very beginning was to have maximum benefit, maximum upside, minimum downside. Obviously, that is the goal for everyone, I would imagine, right? So if injecting every day is going to give me the least amount of estrogenic side effects, then that's probably what I should do right from the start. Now, there's nuance to that. Some people actually feel better injecting less frequently than more frequently. But because I had high SHBG, and apparently a higher injection frequency lowers SHBG more effectively, I thought, okay, that's just what I'm going to do. And one of the things that people were saying to me, actually a few people said this, they're like, wait, so I have to inject every day forever? And this question really kind of perplexes me, honestly, because it's like, the fact that you would even look at it that way tells me that you probably need testosterone, because you don't have to do anything. You don't have to do shit. You get to spend all of 20 seconds of your morning injecting this substance that's going to make you feel fucking great, and you don't have to feel like shit and walk around being a suboptimal, subpar version of you. Like, are you not willing to do that? I honestly don't understand that question. I do get that it's a nuisance for some people, but it honestly doesn't hurt at all. It takes 20 seconds. And if you really, really don't want to do it every day, do it, 3 times a week or whatever. And just keep an eye on your estrogen. And, if it doesn't spike, if you feel good, great. You don't have to do it for the 4 other days. Personally, I do it every day. It doesn't bother me at all. I look forward to it. I look forward to it. It's part of my morning routine. And I just look at it like, man, this is awesome. This is so awesome that we have this available, that I don't have to be that inferior version of me that I was before. Thank you, God. Alhamdulillah. For real. I don't understand that question, guys. It kind of pisses me off, honestly. Okay, now, as far as the actual syringes, this is another question, like, and I've gotten some advice from other people who are way more experienced than I am, who do it in a different way, probably a better way, but here's what I do, anyway, is I'll take a 3 milliliter syringe, 3 milliliter syringe without the needle tip. I'll just get it at the pharmacy, right? It's about this big. And I'll take out the plunger. I'll break open the ampule. I'll flip the ampule upside down. I'll probably make a separate video showing you guys how I do this. And then I'll kind of like hold them together, and then I'll shake it so that the oil goes into the syringe. And know before you ask, no glass gets in there. That's never been an issue. Glass is not going to get, first of all, no shard of glass is going to get through a 29 gauge insulin syringe. It's just never been an issue. And then what I'll do, once I've gotten most of the testosterone in there, is I'll put the plunger back. I'll flip it upside down so that gravity sucks the testosterone down. I'll plunge it forward a little bit to shoot the air out, and then I'll pull it back to create a barrier of air between the tip of the needle and the testosterone, right? And that way, all I do is I will show you guys a video, but basically, this is the syringe, and I'll just leave it standing upright, right? Because I don't want it touching the plunger. And I just heard this. I don't know actually even if it's really that true, but if it touches the plunger, which is like a rubber thing, it could degrade it in some way, and some of it could leak into the testosterone. I don't know. That's maybe not an issue, but that's what I do. And then every morning, I've got my one insulin syringe, the big one. I take out the plunger. I keep the plunger in. I get a small 29 gauge insulin syringe. I take the plunger out of that. And then I take the big syringe and I fill it up to 8 units of a 0.5 milliliter insulin syringe. Now this is key, because if you get a 1 milliliter insulin syringe, right, so it should be about like that big, each tick is 2 units, 2 milliliters, right? 2 hundredths of a milliliter. But if you get the half milliliter, the 0.5 milliliter insulin syringe, each tick is 1/100th of a milliliter. So you can be more precise with your dosing, which is what you want. And you don't need that big of a needle. I mean, you're only filling it up, this much. So why do you need a whole milliliter needle? You don't. And then I'll fill it up to 0.8. I'll put the plunger back in a little bit. I'll flip it upside down, shake it so that the testosterone migrates down to the plunger. I'll push the plunger through to get some of the air out. There might be a bubble. I'll knock the bubble out. All right. Then I'll flip it back. Alcohol pad, wipe, inject, wipe, done. Yeah, I probably should make a video for you guys so that you can actually see what the fuck I'm talking about, because probably didn't make much sense with these pens. But anyway, that's the protocol. And it's very simple, very quick, very easy. I just order a big box of syringes on Lazada. They cost nothing. I order a big box of alcohol pads on Lazada. They also cost nothing. And then I go and get testosterone at the pharmacy, which here it's a Bayer testosterone enanthate. So it's pharmaceutical grade testosterone, no bullshit in it, except the carrier oil maybe. I don't know what they use for that. And it's all Gucci. All right, next topic, titrating up, taking too much testosterone. So I think one of the probably understandable concerns when you're starting testosterone, either for TRT or if you just want to do like a steroid cycle or whatever, is like how much to take, right? And starting back with that first principle of let's get as much benefit as we can with the least amount of negative downsides, right? If that's your guiding principle, then you're not going to know where or what dosage to take to where that is the case, right? And so what we do is we go to like steroidplotter.com. This is a tool that you can use, and you can input your different okay, let's say 150 milligrams testosterone every day through week 4. All right, and it'll show you like the release, and basically what you're trying to do is you're trying to determine like where's your sweet spot, right? You take too little testosterone, you're not going to feel good. You take too much, you're definitely not going to feel good because your estrogen will get too high. And what I did is I started at 80 milligrams per week. Yeah, per week. All right, and then I stayed there for I think a couple of weeks, right? Especially because I was just starting, and then I went up to 85, 90, 95, 100. And eventually, basically every week I would up the dose a little bit, 2.5 milligrams to 5 milligrams. And then eventually I got to about 200 milligrams. Now, when I hit 200 milligrams, I started to feel not as good. Yeah, I started to feel not as good. Got moody, sex drive kind of lowered a little bit, just didn't sleep as well, you know, like just didn't feel as good. Like again, being in tune with your body is the whole thing. And then I was like, okay. And I also remembered from that process of titrating up, I remember where I felt the best, right? Because again, I was just going like week to week. You can't do it day to day because it's not going to be long enough to notice the changes. You got to stay at least a week on a particular dose probably to really notice it, maybe more. And I noticed at around 150 milligrams, 150 to 170 is where I really felt the best. No side effects, no moodiness, very calm actually. And then when I got up to 200, I felt that my sense of calm had dissipated, and I thought, this is no good. Like that's like my favorite thing about testosterone is being calm. And so I said, okay, this is the limit of, or this is the boundary of where this is no longer all upside and no downside. Now I've migrated to more downside with really not that much upside in terms of muscle gain or whatever. So I dropped it back down, and within a few days started to feel good again. So that is kind of how I determined my sweet spot. Now, I don't know if I did that correctly. Maybe I didn't stay long enough at a particular dosage. Maybe some of you guys who are more experienced with this stuff are gonna have a better idea. And you know, again, I'm open to that. But that's just what I did. Seems to have worked okay for me. And now I'm at the, let's see, 8 units. So if I go to calc, 8 times 2.5 times, so I'm at like 140, 150 range. And feeling good. Okay, so that covers taking too much or titrating up. Now let's get into some of the Q&A. Okay, so what's really cool is I posted this on YouTube and got like over 3,000 views. And my YouTube channel is basically not related whatsoever to testosterone therapy. It's like a business channel for my agency. And but I posted it here because I thought people might benefit from it, and got some really cool comments, including some questions, so I'm going to address some of these. Okay, what is your height and weight? 6'1", 102 kgs. Now this guy said, I can't wait to see your follow-up on this video where you speak on dosage, blood work, your age, test levels, etc. The one thing I've noticed that changed a lot is my awareness. Kind of hard to explain, but the brain fog thing is so true. It's like the world got brighter. It does something good to your brain. Yeah, Alex, for sure. And you know, it's hard to, as you said, it's hard to explain to somebody who hasn't felt it, but it kind of makes sense because testosterone is dopaminergic, right? It helps release dopamine. So it's just like if you take a microdose, of mushrooms or whatever, like, or you just have a really good sleep, or you have like a really good day. It's that kind of thing, but it's like every day, which is really, yeah, the world gets brighter, brain fog significantly dissipates. Gotta love that. All right, 55T Millam said, I'm starting testosterone shots this week. Thank you for the video. I'm 52 and praying it will give me some motivation. I really have to push to do anything. If you're as a man, if you really have to push to do anything, that's like the number one sign. And that was definitely the case for me. And like, let's be real, man, like testosterone isn't gonna exonerate you or relieve you of the duty and the burden of being a man and working hard and providing for your family and being big and strong and doing all the shit that you need to do to be the best version of you. It's still going to be hard. You're still not going to want to do that shit every day. And but a lot of the friction, a lot of the resistance does go away. You know, you kind of don't think about it as much anymore. You just go to the gym and you're just working out, and then you're done working out and you get home and you're sitting and working, and you're kind of just working, and you're not just like, you know, dwelling on it as much. You're just doing what you got to do. And that is definitely awesome. All right. This is a funny one from Brother from Another, 1971. He says, thank you for this video, really useful information. I'm listening to you and we are literally living in a parallel universe. You just described me and my life situation to a T, pun intended. Oh, I get it. Okay. I didn't get it before. I got it now. Almost like bloody twins. You have a black British long lost brother here in the UK. I knew my mom was hiding something from me. Congratulations on your journey, bro. You've definitely motivated, inspired me to push harder back into a higher level of training. Just what I needed to hear. Look forward to hearing about your progress in future new subber. Thanks, brother. I appreciate you. This is why I made these videos. Again, I'm not selling anything. I'm not selling coaching. Not selling fucking coaching. I'm not doing any of that stuff. I just want to help my fellow brothers from other mothers all over the world, and that's really my motivation. And when I see a comment like this, it touches me, bro. So I appreciate you. I appreciate that. Adam Vascal said, "Jiu-jitsu without soreness, huh? I'm on a 4 class per week, sparring 3 times schedule, and I lift once each week. I usually need the weekend to recover because I'm pretty beat up. I vividly remember how my body would snap back after running track and playing football in high school. This sounds amazing." Yeah, it definitely helps with that. Although I will say that it's going to help with it more in the beginning than once you've been on it for a few months. Like in the beginning, when you're on the honeymoon period, you'll really feel like fuck. You're like invincible. And after a few months, it normalizes and you do start to get sore, but it goes away way quicker. Like basically I'm good within a day or by the next morning. But one thing I noticed here, Adam, is that if you're lifting once each week, that probably, and you probably know this, but that probably contributes to your soreness because you're not getting an adaptation. You're just, it's not enough. It's enough of a stimulus to cause an adaptation, but it's not going to, you're not going to get sort of like stronger and better lifting once a week because you're not going through this, the stimulus adaptation response, stimulus recovery adaptation response in a progressive linear fashion. You need to lift more than once a week because otherwise all you'll get is sore. Just my opinion, take that as you will. Okay, Wheezy Wins says, I've been on it for about 2 months and the body transformation is insane. I lift 2 times a week, box 1, and jiu-jitsu 1 day a week. Energy level is great and I'm 42. My man. Thanks for the vid. Would you be willing to share your T levels? This is Monty Clayson. Prior and after, okay, that's what I just did in this video. Also curious about what your dosage is. I just started on mine 2 weeks ago at 75 milligrams per week. Yeah, great stuff, man. Let me know how you go. And if you're not feeling sort of better pretty quickly, maybe try titrating up the dose, like what I was talking about in this video, and try to find where your sweet spot is, right? You might be really sensitive to testosterone, and that might be like enough for you, right? Or it might not be enough. I doubt it's going to be too much, but it might not be enough. So let me know how you go. Do you think your mental and kinesthetic aspects in BJJ, such as decision-making, technique, comprehension, or recall, have improved while on TRT? This was a really interesting question, actually, by Omel Yan JP 8700. I kind of sat there and thought about it for a while, because it's actually not a simple question. But I said I don't know, but what I can say is that the only thing really in my experience that makes your jiu-jitsu better is training more jiu-jitsu. And like studying videos and studying techniques, and just basically being really consistent with training, like at least 5 days a week. I have not been consistent with training, and my jiu-jitsu has probably degraded, over the past like 6 months or whatever, just because I work so much and I have a family now, and I'm kind of more focused on lifting, and my shoulder's fucked up, so I'm trying to rehab it. And I'm just not training more than 2 or 3 times per week. And that's really not enough to keep making progress, especially with all these killers out there watching instructionals, and just, man, it's the level is getting crazy nowadays. So maybe it helps those things on some kind of level, but I don't think you're going to really see the benefit of any of that stuff if you're not training frequently and focusing on skill acquisition above all. I will say that recall in general has improved, like memory in general has improved. So maybe there's some kind of slight benefits to that. But again, those are all incidental to just being consistent with your training. Are you concerned? Daniel Stab 6361 asks, are you concerned about having to stay on TRT for a long time? Seems to be difficult to PCT after a prolonged period of use. Daniel, I'm not concerned about that at all. I have no intention of ever coming off it. Why would I go back to where I was? Why would you start that? You don't feel well. You get on TRT. You feel amazing. Why would you go back to feeling unamazing? You don't even really need to come off it to have kids. You can just essentially add HCG to your stack. And then you'll be fertile enough to get your lady pregnant. So I just don't ever see myself coming off. In fact, I see myself trying different steroid cycles, different steroids. I'm very interested in it now, because once you kind of dabble, you start to realize that, holy shit, these substances have been so maligned. They've been, the propaganda, the matrix is really... It's real, man. Even like as an athlete, around athletes every day, there's like fighters, like lifters, all sorts of CrossFit dudes. Steroids is nothing new in Thailand. It's like everyone's on steroids basically. But even then, like a part of me was like, steroids, like I can like fuck my body up and heart attack, like all of this nonsense that is just that. It's just nonsense. Like, if anything, man, if you're intelligent about it, I think that's the key thing. And you listen to your body and you do your bloods and all that good stuff, you're probably going to be a lot healthier. And even if, because you are increasing growth factors and so forth, but even if you contract your lifespan, 5 years, even 10 years, to me, I'll take a 10-year cut in life to be just fucking jacked and energetic and able to play with my kids and spend time with my wife and with my friends and go on adventures and fucking be a beast instead of being a fucking sack of shit and living 10 more years as a sack of shit. Fuck that. Just my opinion. Yeah, I already talked about T levels. Let's see. Awesome video. Thank you, brother. Have you noticed hair loss? No, I've not had any hair loss, and apparently that's a genetic thing. Like, if you're predisposed to hair loss, taking testosterone could accelerate it. But I've thankfully have been lucky in that sense. Okay, dosage, we talked about that. Now, this dude left a comment, and I wanted to address it. He said, Vic, if you started at 750 total testosterone and you're doing 175 a week, you are absolutely into the super physiological range. No discredit into how you are feeling, but by scientific standards, you are not within normal range. Another important point to make for others is that being well into the super physiological range, all the effects are completely different than being inside the normal range. So yeah, you're probably right. Maybe I am in the super physiological range. Again, I haven't done my bloods, but I don't care. I don't care. I feel good. I don't have any side effects. And I did go into a range where I did not feel good, and I did have some side effects. So, I do have some basis for comparison. And again, I'm not chasing lab numbers, and scientific standards means fuck all, bro. Like, it's important to reconcile with lab numbers and with the science, but at the end of the day, all of this steroid stuff is an empirical matter, in a large sense. Like, most of what we know about this area, it has been determined through trial and error empirically by mostly athletes and bodybuilders who made themselves guinea pigs for the benefit of humanity and mankind. And so I'm not really interested in scientific, who sets those reference ranges? A lot of it is, if you're not going by how you feel, what are you going, like, why are you chasing lab numbers? Is that your goal, or is your goal to feel like a fucking beast? Just how I look at it. Okay, brother, what was the way you having testosterone, injections, patches, or gel? Okay, I do injections, we talked about that. And see here, Alex says, I tried daily subs, but my test and estrogen shot up too high for my liking. Now I do 3 times a week intramuscular. Now this is interesting, right? Because supposedly if you do daily injections, your estrogen is going to not shoot up as high. And this guy is saying the opposite. He's saying it shot up too high, and now he does less frequent injections into the muscle. And presumably, Alex, correct me if I'm wrong, your estrogen isn't as high with this protocol as with mine. So that's why I say it's empirical. You can't go, like, the lab numbers might tell you something, right? They might tell you that a particular injection frequency or intramuscular versus subcutaneous has a particular effect. And then on that basis, you might make some kind of data-driven decision. And so that is valid for sure. Lato Houston says, your voice got a lot deeper already too. I don't think it did. I appreciate the comment. But I don't know, maybe you're right, but I'm pretty sure my voice was the same. Maybe what happened, I will say this, maybe what happened is that once you're kind of, and I didn't really have a problem with this before, but one of the things that testosterone does is you kind of swing your dick around a little bit more, right? So you're not really as timid about just speaking at, like a comfortable volume. And, it doesn't mean going around and like fucking yelling and, being that guy either. But maybe that affects the perception of like, oh, your voice got deeper. Well, maybe it was deep before, but maybe I wasn't projecting it. Maybe, I don't know. Maybe you saw some really old videos, but anyway, I appreciate your comment. What's your age? 37. Okay, this guy says, Vic, I have low T but good muscle mass and only sexual side effects. I'm 31 and on the fence about TRT. Did you get any hair loss? So you're saying you have low T, your muscle mass is good, but maybe your libido is not so good. You're 31 and you're on the fence. Yeah, get your levels checked, I would say. Sexual side effects, that's a tough one. I think libido, it depends on the guy, but I think for some guys, libido has to do with like mental stuff, psychological stuff. I know for me, when I was single, when I was dating a lot, Anytime that I ever had any kind of sexual, like a half hard on, or something like that, it was mostly around performance anxiety, mostly just like, but that gets better over time, and then you get old enough to where you don't give a shit, and then everything's working great. So could be psychological, right? I don't know. Could be stress related. It might not even be testosterone related at all. Try Cialis. Cialis works good. From sad to Chad. Well, I wasn't sad before, bro. And you didn't watch the video, which makes me sad. But definitely chattier now than I was before. All right, and final point here. Hey Vic, great video on TRT. I hope, and this is a DM that I got on the gram. Excuse me. It says, hey Vic, great video on TRT. I hope you don't mind I message you privately. I have all the symptoms you said, especially because of jiu-jitsu. Yeah, guys, jiu-jitsu, if you do that shit every day and you're training hard and you're rolling hard and you're doing the porrada and fucking getting after it, especially with these young guys, you're not going to feel good, man. That's the thing. Like, I'm sure you jiu-jitsu guys, if you take like a week off and all you do is just like eat well, rest well, maybe lift weights a little bit, not too much, you're probably going to feel awesome, right? And that's what I talked about in my first video, is like, if you want to keep getting after it, if you want to keep grinding and doing jiu-jitsu like you're 20 years old, fucking go for it. But you're going to need some help. And that was my thing. It was like, I don't want to stop training. I want to keep training like till I'm fucking 90, and I know that I'm going to feel like shit if I don't get on the sauce. So that was a big motivation for me. So the homie here says, hey, thanks for your response. Your total T is pretty high. Mine came out to 520. Free T at 2.2. I talked to my doctor and he said I should lower my stress levels and that he didn't recommend TRT. All right. Fuck your doctor, man. Fuck your fucking doctor. I'm not a doctor, but fuck your fucking doctor. Doctors, primary care physicians don't know jack. They don't know shit about fuck in general, but specifically when it comes to endocrinology, and more specifically when it comes to applied endocrinology, not your textbook endocrinology. You need to get with like a clinic, like an anti-aging clinic, and get with somebody who has real life practical and personal experience with steroids, because the doctors are basically just shills for pharma. They're gatekeepers. They're pill pushers, most of them. No offense to you doctors out there. There's exceptions, but I don't know. In the US, most doctors are fucking Muppets. And like, if you can avoid, like, one place you want to stay away from at all costs is like the doctor's office, the hospital. Like, do everything you can to stay away from those fucking places, because they're going to fuck you up even worse than whatever you had, with maybe the only exception being that if you need some kind of life-saving surgery or some like cancer treatment or something, like, God, stay away from doctors. Like, I can't tell you the gravity of and frequency of incompetence, just gross negligence and incompetence that I've seen. Like, doctors don't know shit, most of them. So if he's gatekeeping testosterone and you aren't feeling, and dude, like, it's your body, if you want to take testosterone, go take testosterone, get it underground. If just do whatever the fuck you want. Don't let this asshole tell you to lower your stress. Shut the fuck up, you fucking asshole. I'm almost 41 and have been feeling like shit the past year, like feel super weak and not myself. I can't do more than 3 jiu-jitsus and one weightlifting session per week or I'll be dead. I know you're not my doctor, but your video was super informative. If you had my numbers, would you give TRT a shot? I didn't even have your numbers, and I gave it a shot. I had slightly higher total. You have slightly higher free testosterone, and you have lower SHBG. But look, again, we're not chasing numbers. Unless there's some, because there could be other issues, right? You could have a thyroid issue. You could have some kind of mineral deficiency. Like I have a friend, he was hypothyroid, and he just found that out by doing like a bunch of blood, like what do they call it? basically like a huge blood panel where they just checked like all his shit, and his thyroid hormone was like super, super low. So he started taking pig thyroid, desiccated pig thyroid, and he started feeling so much better. I had my thyroid checked when I did my first bloods because I knew that often low T symptoms could be confounded with thyroid issues. Thyroid was all Gucci, so I could rule that out. So I'd probably check your thyroid. But if you're 41 and you've been feeling like shit, it's probably time to get on the sauce. I mean, and again, it's not a blanket recommendation for everybody, because I know a dude, right? I know a dude who I train with. He's a Russian dude. He's like 50 something. He's a goddamn beast. He's a unit, this guy. He's just like jacked. He's strong as an ox. He like runs Ironmans. He was in the army. He went to war. Like, he's just one of those guys that's like, since an early age, he was just a fucking weapon. And there's guys like that. And I don't think he needs testosterone. He says he feels amazing. He feels great. He's just one of those dudes. I'm not. And, you know, most people who are experiencing these issues are not. Otherwise, they wouldn't be experiencing these issues, right? So I think it's important to recognize that we're not all cut from the same cloth. And that's kind of a painful thing to accept, but it's true. Genetics plays a huge role. Some people are way stronger than others. Some people are more clever than others. Some people are more aggressive. Some people are better fighters. Like, you know the expression, there ain't no such thing as a halfway crook, right? Like, some people are just born to be psychos. Some people are just born to be like fighters. Some people are born to be intellectuals, whatever. Like, we're not all cut from the same cloth, and it's ridiculous to pretend that I have any bearing to that unit of a Russian bear, because I don't, and I know that. So that's fine. I'm going to work with what I got, and I'm going to do the best, and I wish you the same. So that should wrap up our Q&A. I hope this has been useful for you guys. Thank you for watching all the way through, if you did. If you have any questions or comments, let me know. If you guys are getting value out of these videos, I'll keep making them, because it's fun for me, and I like helping you guys out. So yeah, have a good one, and I'll talk to you guys next time. Thanks.